it's about -1 or hovering right around 0. So the wind chill is probably 15 or 20 below 0. Veterinarians have to get out in this kind of weather. Rain or shine, the pigs have to eat, and pigs still get sick, and we still need to go and try to make sure that we're treating them. There's also ventilation in the barn that's run electrically. We need to make sure that there wasn't a power outage because that's an emergency for us, for our pigs. We have an internally developed animal well-being program, and that's delivered to our employees within the first 90 days of the start of their job. That's one of our primary things of importance to us. That's the goal, is to make sure that our pigs are cared for every day with the best care. And I know we have the pigs in confinement barns. They're indoors, they're all metal. They might look, not very friendly, not like the big red barn with the white trim that we envision. But when I grew up compared to today, the environment that we raise pigs in is much better. These pigs just arrived off the truck a couple hours ago. About the first 4 weeks, they're placed in a barn. They need the most attention. They're laying here underneath the brooder heat, and the room is set at about 75 to 80 degrees. There it'll be more like 85, 90 degrees right under the central part of that brooder heat. So this automatically becomes their lying area or their resting area. And then the back is kind of their eating and watering area here. In the very far back corner, you'll see that's their dunging area, and you can see they're already starting to use it that way. And so that's sort of where their bathroom is. So they established that really early. These pigs just came in. They're 18 to 21 days of age. They got weaned from their mom. They have a new environment. They have a new pen mate. So that's the most intense time of caretaking. This pig doesn't feel very well. His ears are back. His backbone is showing. When I set him down, you'll be able to see that a little bit better. They really don't like to be held very well. So when you hear a pig squealing, anytime a person picks them up, it's not that we're hurting them. That's just what pigs do. Jessica has a pig that has some diarrhea. So he's going to be sorted out. We want to make sure that he gets started on feed and starts to have a full belly and eat better. So our caretaker's taking him out of the pen and putting him in a special pen. It's bigger than just one animal getting treatment and getting cured. We care for a herd of animals, improving the whole sow herd to produce a better pig so that all of the rest of the pigs every day are healthy. They'll bite at each other's tails and cause an injury. And then those pigs can get an infected tail, and then they can get an ascending infection into their spinal cord. So to prevent that from happening, if we cut their tails or dock their tails when they're newborns, we prevent that condition from happening when they're together in a pen. What we're going to do with this saliva is we're going to test it for a couple of viral diseases, PRRS virus and swine influenza virus. So we want to see if these pigs have that virus in their saliva and determine the health status of the sow farm and the pigs. This pig has a condition, Streptococcus suis. It's a bacterial infection. And so he's a little bit skinny, but he's kind of really wobbly. And you see how he's kind of has an abnormal posture. This pig, if not treated, tomorrow would be down laying flat. So if we treat this pig with an antibiotic, hopefully he recovers. So there's a period of time where we need to make sure that after we give a medication, it's called the withdrawal time, and it's the time that it takes for that medication to be metabolized and it's no longer in the system. We try to make sure that we understand that they're there for a purpose, and they're there for us to produce food for people. So they're not a pet, but that doesn't mean we should care for them any less. Well, the pigs look pretty good today. I'm pretty pleased about the new group that came in. The group that was here a week, we found a couple of pigs with strep suis. We're going to get them treated, and I think they'll do just fine. Being a food animal veterinarian is a responsibility, and we have a responsibility to the animal first, so to the pig, to try to cure disease and then to prevent disease and keep them healthy. but also to the human consumer, because we're producing a food animal. Agriculture is a part of me. You know, I grew up in the Midwest, and the people working with us really care about animals and have that same love for agriculture. And so they extend that into the barns and into the care that they give.